Welcome back to the Hometown Healthcare series, where we're interested in perspectives and innovations in community healthcare. Today, I'm excited to have Dexter Sharper join me for a brief discussion. Dexter Sharper, he is a tenured business owner. It looks like over 30 years owning his own business. He's an EMT background, and I think he continues to practice that as well. And he's a state representative for South Georgia. I can tell you that Dexter is a phenomenal individual. Absolutely love him. I always love talking to Dexter Sharper and all the experience he has. Now, in regards to his being a state representative, we're interested in, he served on the Health and Human Services, obviously has that EMT background, so that will help us. So Dexter, welcome. I'm just curious to start off. What's going on out there in community healthcare or healthcare in general that you'd like to share from your perspective?
First of all, thank you guys for inviting me to be a part of this, and I think it's great that you're doing this. That's one aspect that I'm liking to see, since a lot of people are now in social media and they're by their computers and phones and things. I think this is a great way to get information out to people. I'm just really proud of what you guys have done in our community, since forever, since I was a kid. And you guys have done a lot of different things to, keep up with what's going on, and expanding your territories and, the innovation that you have. But like you say, I'm state representative. I was EMT, but then I became paramedic, which is the next, step up. I've been doing that about 30 years. For some of the people that may not understand the difference, the EMT paramedic, we all have to start out as an EMT, but, you move up and do things differently so you can learn the why you're doing things instead of just the what's. Different things that we're seeing, especially since I've been in the legislature, we've seen the situation of Medicaid, looking at trying to get Medicaid expanded for several reasons. I'll just touch briefly on that. There's over 500,000 people that are eligible for Medicaid, but it's not taking place yet in our state. And when you have that situation, those are the people that you see that don't have personal physicians, that are in the emergency rooms, for hours and hours at a time. And when they do get there, after they get to see the doctor, or physician assistants or nurse practitioners, these are the people that get their orders to follow up with their personal physician that they don't have, and they also get prescriptions, orders that they really can't fill for some reason. So I have a little question for you. Are there any available opportunities for people that may not have prescription drug coverage to come to a pharmacy and some type of discounts or discount programs that may be available for them?
Yeah, there is. I mean, we discount medications. We kind of have a program around doing that ourselves to some degree. A lot of people do qualify for Medicare if they're at that, or Medicaid if they're at that poverty level, and sometimes we have to help them, get a plan. They're just not educated on that. It becomes a problem. But yeah, you're right. You said the 500,000. You know that information a lot better than I do, as far as that gap between the Medicaid line and what the Affordable Care Act, that kind of gap in between there. I'm not as well versed on that as nearly as you are, but I know we do help people in that regards, and that's something we take pride in. Can't tell you the specifics on that per se, but so what, as far, the going into the emergency rooms, that's a big deal, right? I mean, they're clogging up emergency rooms for other needs. It's driving up costs. The hospitals have to take them. Hospitals are in pain. You got rural hospitals that are, potentially going under in different times. Right now is a tough time because of how COVID-19 has affected hospitals. Yeah, so there's a lot of turmoil out there, and we definitely do not want individuals in the emergency rooms if they can just simply go to a primary care physician and they can have access to that. And if they don't have coverage, that's not where they're going generally. Is that what you're saying, Dexter?
Exactly.
Absolutely right. Yeah. So anything you're really excited about, that's going on in the community healthcare world, maybe that may be coming down the pipe in the legislature, or just in general, did you see happening out there, education-wise or other?
Well, in general, what I'm seeing, as a paramedic and, both as state rep, but on the ground, what I call it, being that a lot of people are at home, and a lot of people that are still high risk of getting out in the public, with the COVID, I think we need to really focus more on how we can go to the people instead of people having to come out of their homes. Of course, people got to come out on a regular basis, but when you're medical and high risk, even going to the emergency room or anywhere like that is a high risk as well. But preventive medicine to me is always, the key on a lot of things. So I'm thinking that even as community paramedics, community nursing, going out to the people is one area where we need to focus on a little bit more and follow up with people, making sure people are taking their medicines, making sure people properly know how to do their breathing treatments, making sure they're taking their meds at the right times, figuring out a way that we can get their caregivers or even their family members to assist in making sure these things are done. Because, a person can go to the hospital, they're in the hospital, especially ones that may have mental illness or older people. You can give them their discharge papers and say, here's the plan, this is what we want you to do, this is how you want to be done. But once they get home, they get delivered. A lot of times, some of those people we discharge, we take by ambulance, and some, just walk the way they need to, a wheelchair or whatever. But the ones that we take home, they still need that extra person. And sometimes if they don't have the opportunity to have maybe a nurse or they're not on home health for some reason, that they're just home with their family, we need to create a way. And, there's several opportunities that we can come up with or brainstorm and say, hey, who can go out there to homes? Who can help, these people? I know you guys have been innovative in trying to put things together to check on your patients, make sure they are, taking their meds and doing it the right way, and overall health, so we can keep down the readmissions to the hospitals. So, that's where we need to be.
Yeah, you're hitting the nail on the head, Dexter. That's all the things that I'm in perfect alignment with you. All the caregivers, transportation, education, someone that's connecting, scanning that home environment. And you said, you said preventative health care. I mean, those things are all the right pieces of the toolkit that we have to implement and get better. And how do we incentivize that a little bit more? How do we create good systems of doing that? Where does the state have a role? From your perspective, or to kind of realign these things. I know that I do want to give you some accolades. You have been a phenomenal supporter of the pharmacy industry as a whole in the state of Georgia. You've supported everything that we've tried to move and pass in that regards for pharmacy to help release some of the burdensome regulations. So I really thank you for the work that you have done in the past. But yeah, we have these big problems, and they're being exacerbated by COVID-19 to some degree.
Right.
Our infrastructure, getting people in the home, and what I see with us being a pharmacy, we get a little bit different perspective because we can see all the medications they're on if we have access to that. If they're not going to other pharmacies, we can see all the medications on. That helps us kind of get a bigger picture. Some individuals, they go into the home, they may not be able to see that whole picture. So we want to make sure they have all the information, all the tools at their disposal. If we have an infrastructure of workers going into the home, healthcare professionals going in the home, we want to make sure they have the big picture. So any other thoughts on this subject?
Well, the thing about it, the stakeholders that's involved, which is kind of like everybody, but in order to put something like this together, you have to get all the people that are actually affected by it, and a lot of hospitals, the pharmacies, just everybody. We just need to kind of come up with it could be a little organization or a little group of stakeholders, public and private, to get together and identify that this is something that we need to move forward on, especially during these times. And I think it'd be a good thing to shoot for 2021, to put together a group of people and say, hey, look, we're all about people's health. This is your part, the transportation person, the pharmacy, the hospital itself. Then on the public end of the churches, maybe, some of the other clinics, public health, to be involved. So if you get probably about 8-10 different organizations sitting at the table and say, okay, the main goal is preventative health care, and also the main goal is the patient. And then we can come up with something that will benefit, the people in the community that really need the help, that don't have the insurance or things like that. But I think that's a thought. I think that'll be something that we can actually put towards, to be on our radar.
Are you coming at that as a statewide initiative? Are you coming at that every community has to do something in that regards, around the resources specific to those communities?
But what I can do, looking at the health and human services part of things, but I think me personally, being the policy government programs, I'm a big part of the Andrew Young Policy Center, where we can actually get them to actually do some research for us to see how we can actually put that together and see what stakeholders need to be involved, public and private. And then I can myself go ahead and try to get something like that going. And then it's something that can be spread out and probably piloted here in Valdosta first and see how it goes. If it goes well, we'll iron out some of the bugs here and there, and then we can present it even in some of the areas that you have in Georgia as barns, to do it in one of those cities and put the same thing together. And then next thing you know, we just spread it out all over if possible.
Hey, count me in. We're 100% on board for something like that, Dexter. That sounds amazing. We pulling together our resources, getting our community involved. That's the way forward in healthcare.
Right.
And then supporting those that it's removing those barriers to health. We hear it, social determinants of health. It's a common buzz term in healthcare anyway. Removing those barriers. It takes the community to do that. There's really no other way to do it. Everyone has a piece that they can do to make that happen. So, Dexter, thank you for joining us today. I'm so excited that you continue to be a representative. I think there's an election, but you're probably going to pose because you're phenomenal around here. I'm maybe getting that wrong, but I know you do a phenomenal job. The community really looks up to you, and I do as well. Even when we have differences, you're easy to talk to, and you really do a lot around here. So we appreciate you, and look forward to doing more interviews like this on the Hometown Healthcare Series, and look forward to talking to everyone out there in the future.